Hi, I'm Doug Brown. I'm here at Dr. Shanthala MD's office, and I'm here to have a procedure for something that most men or most people don't even understand, which is called Peyronie's disease. Peyronie's is a condition that happens over time for most men, and quite frankly, it's a little embarrassing, but it's where the penis actually starts to have a curvature to it, and it happens gradually over time. And many men are embarrassed by it, and many men don't understand what it's all about because it's happening, and they're trying to figure out, well, why is this happening to me? That's what was happening as well to myself. And so I was seeking out multiple treatments, and frankly, there wasn't a lot that I could find online at the time. And then I would find things of, magic potions and magic pills, and those wouldn't work, and different types of contraptions that people wanted to sell. I eventually decided that I was going to just take the medical route, and so I went and had a couple of injections of what they call Xylaflex, and Xylaflex is a kind of an enzyme that eats away. What happens is plaque gets underneath the skin. It's due to either an injury or sometimes an allergic reaction, and it's really kind of what the medical community calls idiopathic. It's really not a cause that somebody really understands why this happens. And it's been interesting to me because, now that I've had the issue and I've talked to other people, and they now know they have the issue, but they didn't even know what it was. So as I was progressing through this process with the Xylaflex, I actually got some results. The Xylaflex are a series of injections. However, they're very, very costly. 2 little vials of medication are actually $9,000 from the pharmacy. And so I had a couple of those, but then the insurance wouldn't support it any longer. So I was looking for other alternatives because even though I got some results from it, I wanted more of a natural type of process, because while I went through those, I had things called hematoma, which is where the blood vessels sort of burst within inside the skin, or it felt like that anyways, and things would swell, and it was very painful. Anyways, I'm here because I went through what is called the P-Shot, and the P-Shot is a process where they use your own natural blood and what they call PRP, I believe it's called. And what that does is it goes in and it actually does a very similar thing that the Xylaflex does. However, it's not a series of multiple injections that you have to go through, and there's no adverse reaction to it. So I had one done already, and immediately I started noticing a vast change, and for the positive. So where the curve was still a good size curve, it started straightening out immediately on all angles. And so it's been very successful for me, so I'm back to have another one because I got better results this time, the first time, and I want to have better results the second time. So the good thing about the PRP in the P-Shot versus the Xylaflex for myself was not only do you not have to have insurance get involved, but number 2, it's very quick. So the time recovery on the P-Shot versus the Xylaflex shot, the recovery time was instantaneous. Really, that day, it wasn't painful after that. It was very straightforward. But with the Xylaflex, you do it in one day, and then you got to wait a couple days, and you go back again, and they're constantly, I'll just, for lack of better terms, using an invasive type of process. And so there's a week to 4 week recovery time. And what I noticed with the P-Shot was the recovery time was instantaneous. I was recovered that day and back to normal function. And so, I'm here to talk about this because most men, frankly, they don't want to talk about it. It's kind of embarrassing to them. And, this happens to a lot more men than people know. So I'm here to answer a series of questions as well, so there may be some questions thrown to me at this point.
Well, Doug, thank you very much for talking. I appreciate it. Very well said. I was just wondering, does this hurt? Do you have any pain when you're having the procedure done?
No, I mean, because they're numbing up the area, you do feel a slight pinch when the needle is inserted, but it's not painful. It's At least it wasn't for me. And I don't think it's anything worse than what I would consider maybe a mosquito bite or a bite like that. And then once the pinch is gone, and I didn't feel a thing, honestly.
How many shots do you think would be optimal to get the results that you desire?
Well, I think it depends on the person's condition. I've talked to men who have, slight curvature, and, unfortunately, the more curvature that one has, then it's a challenge with all kinds of functions, whether it's sexual function or also urinary function as well. I was running into that in the beginning. And that's one of the reasons I just said, I didn't know about the P-Shot before, so I just went to the Xyloflex because that was the only thing that medical doctors who are traditionalists would recommend. So I got results in my first P-Shot. So for me, I'm back because I want more results, but I noticed an immediate straightening, and I noticed an immediate, I used to have an indenture on both sides where the curvature was happening, and they both went away within an hour. I was like, wow, what happened? And now the reason I'm back is because over time, the curvature, the indenture on the left is completely gone, and the one on the right is slightly back, so I want to get rid of that as well. The other thing that I noticed immediately, I noticed a size increase immediately, so length and girth, width as well. So, for me, it was pretty immediate. But I think most men probably should look, between 1 and 4 treatments, probably on average, to make it work out right. And the reality is, when you compare it against the other, even with co-pays on insurance, what I have found is this is much more economical. And the recovery time, the second Xyloflex shot I had, it took me about 4 weeks to recover. So, and it was painful for about 2 weeks.
Did you feel that you had your privacy respected when you came into the office?
Here?
Yes.
Yeah, oh, absolutely.
Yes.
Yeah, I'm kind of I'm not really that modest anyways. Probably one of the reasons I'd be willing to do this, but I do understand that many men, in different professions, and I sort of have a public persona profession, so to do this is actually a stretch for me. But I think it's so important that, a lot of men, a lot of guys out there, they're suffering with this condition, and, it's affecting their whole life. It was affecting my whole life. And I think that, the privacy here was respected as well as anywhere I've ever been. In fact, better so. And what I got here is, in the other medical community, because they're dealing with insurance companies and they're running people through the mill and they've got such a high overhead on a lot of things, there wasn't, I would say, that personalization that I got here by any means. Sometimes I would have to wait an hour to get in for the procedure on the other place, or, a couple times the doctor was so busy because they were out on call all night long, they were sleeping and they couldn't even get back to the office, so I had to go back a couple of times, and it was an hour drive for me because there's not a lot of people who actually do this type of treatment. And so, certainly it's more far and few between. So when I found this, and I found it in my local area, I was like, you know what, I'm going to give it a shot, and I'm very grateful I did.